Respiratory therapy post-COVID. The journey to restore respiratory function after the pandemic. Introduction. Since the outbreak of the COVID-19 pandemic, millions of people worldwide have endured the battle against the disease caused by the SARS-CoV-2 virus. COVID-19 is not only an acute illness with symptoms such as fever, cough, and shortness of breath, but it has also left a deep impact on the respiratory system and the overall health of many individuals, lasting for months or even years after recovery. The damage caused by the virus is not simply limited to an acute pneumonia episode, but includes long-term consequences on lung tissue, respiratory muscles, and the nervous system that controls breathing functions. In reality, many people who have had COVID-19, despite testing negative, being discharged from hospital, or surviving the severe phase, still face persistent symptoms such as exertional breathlessness, prolonged cough, feelings of air hunger, and significant physical weakness. These effects not only reduce quality of life, but also impair the ability to work, move, and carry out daily activities. Therefore, respiratory therapy post-COVID, also known as post-COVID respiratory rehabilitation, has become an extremely important and urgent field in modern medicine. Respiratory therapy post-COVID is not merely about simple breathing exercises or conventional physical therapy. It is a comprehensive recovery journey that requires close collaboration between healthcare professionals such as pulmonologists, physical therapists, mental health caregivers, and the patients themselves. The goal is to restore optimal respiratory capacity, improve lung volumes, strengthen respiratory muscles, and simultaneously reduce long-term complications that may arise, such as pulmonary fibrosis or chronic lung function decline. Moreover, respiratory rehabilitation is also a pathway for patients to regain confidence, mental balance, and better reintegrate into everyday life after the pandemic. In the context where new variants of COVID-19 continue to emerge, along with the widespread impact on public health, respiratory therapy post-COVID is not just a medical trend but a necessary mission for millions of people worldwide. In the following sections, we will explore in greater detail effective methods for respiratory rehabilitation, the challenges encountered during this process, and how each patient can actively participate in their own health recovery journey. Impact of COVID-19 on the respiratory system, a comprehensive assault and lasting sequelae. COVID-19 is not merely a simple infectious disease, but a medical crisis causing profound and complex damage to the respiratory system. The SARS-CoV-2 virus, the causative agent, has the ability to invade and directly attack the epithelial cells of the lungs, delicate cells lining the surface of alveoli, where the most crucial oxygen and carbon dioxide exchange takes place in the body. 1. Acute lung injury. Once the virus enters the lungs, it triggers a strong inflammatory response from the immune system. Immune cells are recruited to the lungs to eliminate the virus, but this process also damages lung tissue. The lungs become inflamed, swollen, and filled with fluid and dead cells, leading to acute pneumonia. In many severe cases, widespread inflammation causes acute respiratory distress syndrome, ARDS, resulting in impaired gas exchange and severe oxygen deficiency in the blood. 2. Chronic damage and long-term sequelae. The acute injuries described above do not always fully heal. For many patients, prolonged or poorly controlled inflammation leads to the formation of scars on lung tissue, known as pulmonary fibrosis. Fibrosis causes lung tissue to thicken and stiffen, losing the elasticity necessary for expansion and contraction during breathing. As a result, lung capacity decreases, gas exchange efficiency declines, and patients may develop chronic respiratory failure, which is difficult to completely recover from. Besides lung tissue, the small blood vessels in the lungs are also seriously damaged due to inflammation and thrombosis, blood clots. This condition disrupts blood circulation and reduces oxygen transport efficiency, further worsening breathlessness and respiratory failure. 3. Effects on respiratory muscles and the nervous system. COVID-19's impact is not limited to lung tissue. It also broadly affects organs involved in the breathing process. The diaphragm, intercostal muscles, and accessory muscles may weaken due to systemic illness or prolonged hospitalization, especially in patients requiring extended mechanical ventilation. This muscle weakness makes it difficult for patients to take deep breaths or maintain steady breathing rhythms, increasing sensations of breathlessness and fatigue. Moreover, the virus can affect the central and peripheral nervous systems that regulate breathing. Neurological disturbances may cause dysregulation of respiratory rhythm, making breathing inefficient and hard to control, particularly in patients with severe symptoms or neurological complications. 4. Systemic effects leading to physical weakness. COVID-19 is a systemic disease that can cause widespread inflammation affecting many organs and systems. Prolonged systemic inflammation, combined with extended hospital stays, reduced physical activity, and other complications, leads to severe physical deconditioning. Patients often feel fatigued, weak, and have difficulty moving, which reduces oxygen supply and hampers respiratory function recovery. These factors create a vicious cycle. Decreased physical strength limits deep breathing and movement, leading to mucus buildup in the lungs, increasing the risk of infection and further respiratory failure. 5. Injury patterns by patient groups. The severity of respiratory damage and sequelae from COVID-19 vary significantly among patient groups. Those with severe disease requiring mechanical ventilation or special medical interventions are at higher risk of extensive lung damage, severe respiratory failure, and long-term sequelae. Conversely, mild or moderate patients may still experience prolonged symptoms such as exertional breathlessness or persistent cough, although the extent of damage may be less severe. Especially, patients with underlying conditions such as chronic obstructive pulmonary disease, asthma, or other chronic respiratory illnesses often face greater challenges during recovery. 6. Importance of early detection of damage. Early assessment and detection of respiratory damage after COVID-19 are crucial for determining appropriate rehabilitation plans. Diagnostic methods such as chest CT scans, pulmonary function tests, and continuous oxygen monitoring help identify hidden injuries that patients may not clearly perceive. This enables doctors to evaluate severity and risk of complications, design respiratory rehabilitation programs, apply breathing exercises, physical therapy, and supportive treatments to optimize recovery potential. Common respiratory symptoms after COVID-19, persistent signs that require attention. After overcoming the acute phase of COVID-19, many patients continue to face lingering symptoms that directly affect their respiratory capacity and overall health. These symptoms not only cause discomfort, but also diminish quality of life, impacting daily activities and workability. 1. Persistent shortness of breath and breathlessness. One of the most common and obvious symptoms is shortness of breath, especially during exertions such as climbing stairs, brisk walking, or heavy work. Many patients also complain of breathlessness even at rest or while lying still. This indicates ongoing lung damage and impaired gas exchange, resulting in insufficient oxygen supply to the body. Prolonged breathlessness is not only a physical symptom, but can also cause stress, anxiety, and psychological distress, creating a vicious cycle that worsens breathing difficulties. 2. Prolonged cough with or without phlegm. Cough is another frequent symptom after COVID-19, particularly dry cough or cough with phlegm lasting weeks to months. Phlegm may result from airway inflammation, lung tissue damage, or secondary bacterial infections. Persistent cough not only tires patients, but also disrupts sleep, communication, and social activities. 3. Chest pain or feeling of pressure. Many patients report dull or pressing chest pain, sometimes related to pneumonia, pleuritis, or respiratory muscle injury. This sensation causes anxiety and fear, potentially leading to reduced movement and exercise, negatively impacting recovery. 4. Fatigue and reduced exercise tolerance. General fatigue and decreased stamina result from prolonged inflammation, impaired respiratory function, and reduced physical activity during hospitalization or rest. Patients easily become breathless with mild activity and cannot maintain physical tasks as before, leading to muscle loss, decreased fitness, and weakness. 5. Reduced lung capacity and gas exchange. Lung tissue damage and fibrosis after pneumonia reduce lung capacity, the volume of air the lungs can hold and exchange. This limits oxygen absorption and carbon dioxide removal, worsening breathlessness, fatigue, and reducing exercise ability. 6. Sleep disturbances due to breathing difficulties. Persistent breathlessness and coughing often disrupt sleep, causing insomnia or poor sleep quality. Prolonged sleep disturbances increase fatigue, impair concentration, and negatively affect mental health and overall recovery. Long COVID, post-COVID syndrome. These symptoms often persist for weeks to many months after patients test negative for the virus, collectively called post-COVID syndrome or long COVID. This poses a significant challenge to healthcare systems and patients, as there is no specific cure, requiring comprehensive care and rehabilitation. The role of respiratory rehabilitation after COVID-19 towards the revival of breath and vitality. Respiratory rehabilitation after COVID is not just about helping patients breathe easier. It is a process that improves overall physical and mental health, aiming to help them reintegrate into normal life as effectively as possible. 1. Strengthening respiratory muscles. Specialized breathing exercises strengthen the diaphragm, intercostal muscles, and accessory respiratory muscles. Stronger respiratory muscles enable deeper and more efficient breathing, reducing strain on the nervous system controlling respiration and alleviating breathlessness. 2. Improving lung capacity and function. Rehabilitation includes techniques for deep breathing, lung expansion, and coordination of respiratory muscles to increase lung capacity and enhance gas exchange. This helps reduce symptoms of breathlessness and increases oxygen delivery to body tissues. 3. Reducing breathlessness and cough. Through breathing exercises and chest physiotherapy, patients better manage episodes of breathlessness and prolonged cough. Clearing mucus and improving lung ventilation contribute to greater comfort and better sleep quality. 4. Enhancing endurance and physical fitness. Rehabilitation focuses not only on the respiratory system, but also on improving overall fitness through light aerobic exercises, increasing stamina and mobility. Improved physical health boosts patient confidence and lowers the risk of respiratory relapse. 5. Improving quality of life and mobility. The outcome of respiratory rehabilitation is that patients can return to everyday activities such as work, family life, social, and sports activities normally. Methods for respiratory rehabilitation after COVID-19. The journey to reviving breath. After overcoming the acute phase of COVID-19, many patients still face prolonged after-effects, especially problems related to respiratory function. To help them recover and improve their health, respiratory rehabilitation methods play a crucial role. Below are effective approaches that have been researched and widely applied in practice. Controlled breathing exercises. Breathing exercises not only help improve respiratory capacity, but also reduce anxiety, increase relaxation, and better manage symptoms of breathlessness. Important techniques include diaphragmatic breathing. This is a deep breathing technique that efficiently engages the diaphragm, increasing oxygen intake into the lungs. By focusing on diaphragmatic breathing, patients reduce the strain on accessory respiratory muscles, such as neck and intercostal muscles, thereby decreasing fatigue and the sensation of breathlessness. This exercise is usually guided to be done slowly and gently in a comfortable posture, helping improve circulation and gas exchange. Pursed lip breathing. This technique slows the breathing rate and lengthens the exhalation phase, reducing pressure inside the lungs and preventing airway collapse. It is especially useful for patients with airway obstruction or difficulty breathing. Typically, the person inhales gently through the nose and exhales through pursed lips as if blowing out a candle, helping better control breathing rhythm and reduce shortness of breath. Rhythmic breathing. This exercise helps patients learn to regulate their breathing rhythm, avoiding hyperventilation that can cause dizziness and fatigue. By establishing a steady breathing pattern, patients can improve respiratory system stability and reduce discomfort symptoms. Physical exercise and fitness improvement. Comprehensive physical rehabilitation not only enhances lung function but also increases endurance, cardiovascular health, and overall mobility. Recommended exercises include light walking or stationary cycling. These are moderate aerobic activities suitable for most patients, raising heart rate, improving circulation and respiration without causing overload. Yoga and breathing combined with movement. Yoga enhances body flexibility, improves chest expansion, and trains proper breathing techniques. Aerobic exercises or personalized training programs. Based on individual capacity, exercise programs are gradually intensified to safely and effectively improve fitness. Regular physical activity also prevents muscle atrophy, loss of strength, and improves mental health. Use of respiratory support devices. For patients with impaired respiratory function or sleep disorders such as sleep apnea, respiratory support devices are vital. Positive airway pressure devices, CPAP, BiPAP. These machines provide continuous or bi-level pressure to keep airways open, preventing airway collapse during sleep and improving breathing. They help patients sleep better, reduce daytime fatigue, and improve respiratory function. Incentive spirometry. This device encourages deep breathing, lung expansion, and mucus clearance, reducing infection risk and enhancing lung mobility. Oxygen therapy. For patients with prolonged low blood oxygen levels, home oxygen therapy is prescribed to supplement oxygen, improving activity capacity and quality of life. Chest physiotherapy. Chest physiotherapy techniques help clear the airways, reduce mucus, improve ventilation, and lower the risk of lung infections. Common methods include chest percussion and vibration. Gentle tapping or vibration loosens mucus, making it easier to expel during coughing. Postural drainage. Patients are positioned to use gravity to help mucus drain from the bronchi. Cough reflex stimulation. Exercises or techniques to help patients cough effectively to clear mucus. Suctioning. In necessary cases, healthcare workers use suction tubes to remove thick or excessive mucus to clear airways. Psychological support and health education. Prolonged breathlessness and post-COVID symptoms can cause anxiety, depression, and stress. Therefore, respiratory rehabilitation must include psychological support. Psychological counseling helps patients manage negative emotions, overcome fear, and strengthen their fighting spirit. Breathing technique education guides patients to understand and correctly practice breathing techniques, manage symptoms at home, and gain confidence and control. Community and recovery support groups. Participating in support groups to share experiences, receive empathy, and encourage. Implementation challenges and considerations in post-COVID respiratory therapy. The journey to full respiratory recovery after COVID-19 is complex and fraught with numerous challenges that healthcare providers must navigate carefully. Unlike many traditional respiratory conditions, post-COVID lung impairment presents with a wide spectrum of manifestations, ranging from subtle functional decline to severe, irreversible fibrosis, demanding a nuanced and flexible approach to therapy. To optimize outcomes, several critical factors must be considered during the implementation of respiratory rehabilitation programs. 1. The necessity of an individualized approach. One of the most significant hurdles in post-COVID respiratory therapy is the marked heterogeneity of pulmonary involvement among survivors. This variability stems from differences in viral load, immune response, pre-existing health status, and the severity of the initial infection. Some patients may experience mild symptoms with near-complete recovery, while others face persistent dyspnea, chronic inflammation, or even progressive lung fibrosis. Consequently, rehabilitation programs must be meticulously tailored to the unique clinical profile of each patient. A one-size-fits-all protocol risks undertreating some individuals or overwhelming others with excessive demands that could exacerbate symptoms. Individualized plans take into account lung function parameters, exercise tolerance, psychological status, and comorbid conditions to determine appropriate intensity, duration, and modalities of therapy. Customizing therapy also involves setting realistic goals in collaboration with patients, fostering motivation and adherence. Periodic reevaluation allows clinicians to adjust programs dynamically, responding to improvements or setbacks. This flexible and patient-centered approach is fundamental to maximizing recovery potential while minimizing risks. 2. The essential role of multidisciplinary teams. The multifaceted nature of post-COVID respiratory sequelae means that no single healthcare professional can address all aspects of recovery. Effective rehabilitation requires a coordinated, multidisciplinary effort bringing together diverse expertise. Pulmonologists provide the cornerstone medical oversight, diagnosing the extent of lung impairment, prescribing treatments, and monitoring progression. Physiotherapists design and guide exercise and breathing regimens, ensuring safe and effective physical reconditioning. Psychologists or mental health professionals address the psychological toll of prolonged illness, which can include anxiety, depression, and post-traumatic stress disorder (PTSD), all of which negatively impact respiratory symptoms and patient engagement. Nutritionists play a vital role in optimizing nutritional status to support tissue repair, muscle strength, and overall energy levels. Nurses and respiratory therapists often provide essential day-to-day patient education and assist with device management, such as oxygen therapy or ventilatory support. This integrated team approach not only ensures comprehensive care, but also fosters communication that helps align therapeutic goals across disciplines. It enables the identification of potential complications early and the delivery of holistic support that addresses both physical and emotional dimensions of recovery. 3. Telerehabilitation, expanding accessibility through technology. Geographical barriers, mobility limitations, and ongoing risks of infection have spurred the growth of telerehabilitation as a promising alternative or adjunct to traditional in-person therapy. Remote guidance using telemedicine platforms allows patients to engage in supervised breathing exercises, physical training, and counseling from the safety of their homes. Telerehabilitation offers several advantages. Broader reach. Patients in rural or underserved areas gain access to specialized expertise without the burden of travel. Flexibility. Sessions can be scheduled around patient availability, improving adherence. Safety. Reduces risk of exposure to infectious agents critical for immunocompromised individuals. Cost-effectiveness. Lowers expenses related to transportation and facility use. However, telerehabilitation also presents challenges such as variability in patient technological literacy, need for reliable internet access, and limitations in performing hands-on assessments. Careful selection of suitable candidates and investment in user-friendly platforms and training are necessary to overcome these barriers. 4. The imperative of rigorous monitoring and follow-up. Given the evolving nature of post-COVID lung pathology, continuous monitoring is indispensable for guiding therapeutic decisions and detecting complications early. Follow-up protocols typically include pulmonary function tests, PFTs, measure lung volumes, capacities, and gas exchange efficiency to quantify